we do have to have this debate around social care more widely, around how we staff the workforce. And the reality is just trying to use immigration as a sticking plaster is not going to work.
Tell me, what did you make of what you heard?
I think generally a lot of it was fairly welcome, including some things I've called to be done for quite some time, like removing the 20% discount on the SOL. In fact, if you look at the website Dave has been talking about, will employers need to pay more? Some of the actual thresholds and jobs are actually below the minimum wage on the per hour rate. Yes. So actually employers are already having to pay more than what the migration threshold was. So there are some quite welcome changes there. And also it's worth noting on things like health and social care, the petition continues that, for example, nurses and those paid on NHS pay rates, they've always had to be paid the equivalent rate in the UK labour market for the job. It just, in the wider section of society, removes the ability to try and effectively pay less than the going rate in the UK labour market, which was a bizarre place to be for a job that's already in shortage.
Yeah, I wonder what a lot of people will be wondering. Perfectly objectively, Kevin, I mean, you make a point that a lot of people working in the care sector surely should be paid more than the very low wages they're being paid at the moment. Nonetheless, their employers, you know this, at least as well as everybody else, those employers say they can't afford to do that. And now we're looking at banning people from being family members, which will mean a lot of care workers won't come here at all. It means great gaps in workforces in an already overstretched care sector. That's got to be a worry, Kevin, isn't it?
Well, I represent a community that has a lot of people who are reliant on social care services. But if we think the vision for social care for the future is of low wages and poor terms and conditions, then I think we'll find that many of those vacancies will continue. And in parts of the country, paying someone the minimum wage in a place where they would be very unlikely to get housing.
Yeah, but the suggestion is that I'm putting it to you that those problems, they may well continue, as you say. But I'm saying these measures will make it worse.
Well, I think the point being made in the chamber is actually quite right to say that if more dependents are coming and people actually working on a visa, you have to question that in itself. There are some concerns about how some people have been treated who were brought in under the health and care worker visa. Those have been widely reported. So again, the CQC regulation makes eminent sense in terms of trying to tackle some of those, aside to what anyone thinks about who should be eligible for the visa. But we do have to have this debate around social care more widely, around how we staff the workforce. And the reality is just trying to use immigration as a sticking plaster is not going to work.
All right, Kate McCann's here.
I just want to know whether you have any concerns about changing the 20% discount, whether there might be an inflationary impact on some of these changes. If you're going to pay people more, whether that might have an impact in that way.
Well, as I've just outlined, actually, and if you pop on the Home Office website now, you'll see that a number of the jobs with the 20% discount applied immigration threshold is below the minimum wage. So under employment law, you have to pay the minimum wage anyway. It's also quite hard in reality for an employer to pay some of their staff 20% less. That doesn't really work in terms of how you can function a business. But what it does mean is you can't look to immigration to pay less than the standard rate. So actually, in some cases, the wages are already higher because you can't lawfully pay the minimum rate for the skilled worker visa, hence why this provision was urgently in need of removal.
Okay, look while you're here, we're going to be talking clearly about unlawful migration later on in the week and the Rwanda deportation policy. Just one point that sort of leapt out at me today. It's in the Telegraph. They say that the plan being put together by the government, our government, and the Rwanda government, would mean that migrants who are sent to Rwanda, assuming they are, if they're denied asylum status there, they would be returned to this country. What do you make of that? It seems like a bizarrely circular policy.
Well, let's not get too much into speculation when we can probably in the next day or two hear what's actually...
But what do you make of that, though, Kevin?
Well, when I was dealing with it, there was a resettlement package that would be assigned to funding to Rwanda. But I think if someone was granted asylum there, but I think today I don't really want to get into conflating the two issues between what we need to do to make sure legal migration systems support our wider labour market and public services versus what we need to do to deal with those arriving via unlawful means.